Hello, and welcome to the January edition of Pulse, the monthly webcast produced by the Indiana State Department of Health to keep Hoosiers informed of events and health trends in Indiana. I'm your host, Megan Wade-Taxter. January is Cervical Cancer Awareness Month. So today, we'll be talking with State Health Commissioner Dr. Kris Box regarding what you can do to decrease your risk of developing cervical cancer. Welcome, Dr. Box. Thank you for joining us this month.
Thank you for having me, Megan.
So January is Cervical Cancer Awareness Month. I know that in Indiana, about 250 new cases of cervical cancer occur each year, and that there are 85 deaths related to cervical cancer among Hoosier women each year. So what are some important facts that people need to know about this type of cancer?
It's important to remember that cervical cancer used to be much more common in our state until we increased our screening with the Pap test. This allows us to detect and treat precancerous lesions of the cervix.
Okay, and so with a Pap test, what kind of testing are you talking about?
The Pap test is done at the time of a routine pelvic exam by your healthcare provider. It involves taking a sample of cells from the outside of the cervix and the inside of the cervix, and then we send those cells to be analyzed. In the United States, we recommend that screening begin at the age of 21 and then is done every 3 years in the low-risk population, as provided that your screening is normal. After the age of 30, if we add co-testing for the HPV virus, that increases our detection of cervical abnormalities.
If you are a woman living in Indiana and have financial difficulty in getting the breast and cervical health care you need, you may qualify for free screenings and diagnostic tests through the Indiana Breast and Cervical Cancer Program. Women who have already been diagnosed with breast or cervical cancer can have their treatments covered under Indiana Medicaid. Visit the Indiana State Department of Health's website to see if you qualify. You'll find that link below this video in the comments section. Great. And besides getting regular Pap screenings, what else can women do to reduce their risk?
Well, the best thing that you can do is to prevent exposure. But if you're sexually active, limiting your number of sexual partners and using condoms, even if you're using another form of birth control, helps to prevent the spread of HPV and therefore cervical cancer. If you smoke, quitting can help to reduce your risk because smoking affects your immune system, and the immune system is very important in suppressing the HPV virus. But most importantly, the best thing that you can do is to be immunized against the HPV virus.
So what is HPV and why is that vaccine so important?
Human papillomavirus is a viral infection that is passed between people with skin-to-skin contact. This can be passed through sexual contact and can affect your genitals, your mouth, or your throat.
And that vaccine, why is that so important?
HPV vaccination actually prevents over 80% of cervical cancers. The ideal time for vaccination is ages 11 to 12, but it can be given up to the age of 26. Both boys and girls should be immunized. The vaccine, if given before the age of 15, only requires 2 doses. After the age of 15, requires 3 doses. The vaccine is most effective if we give it to young girls and boys before they become sexually active.
Great. So thank you so much for joining us this month and providing that important information.
It was a pleasure. Thank you.
To learn more about cervical cancer and how to reduce your risk, visit the Indiana Cancer Consortium's website at indianacancer.org. You can find a link to their website as well as other resources below this video in the comments section. And if you would like help quitting smoking, call the Indiana Tobacco Quit line at 1-800-QUIT-NOW. Until next month, thank you for watching the January edition of Pulse.